So it's actually 6 o'clock in the morning on Friday, the 5th of February 2021, and I'm going to be going back to the hospital this morning for my second dose of IV methylprednisolone to treat the arachnoiditis flare. As you can see, I'm up doing this video for once. Come down for a cup of tea. Unfortunately, I didn't have the greatest night's sleep again. Yesterday, I was doing much better. I was able to be up more and do more, but still had a lot of pain and symptoms, obviously. As I said, it reduced symptoms, but they were still there. But it did still build up towards the end of the day, but nothing like it had been before I had the steroids, like the day before. So I was in quite a lot of pain and decided to go to bed pretty early. So at 9 o'clock I went to bed and I took a Zopiclone again just to try and make sure I got sleep. But unfortunately, how often goes, even when you're using the sleeping tablets, that I maybe got to sleep about 9:30, 9:45, but I was awake sometime between about 1:30 and 2, and I've been awake ever since, which is really rubbish. But as I was saying, it's kind of the way it goes when you're in these flares, and probably with getting the treatment and stuff like that. So it is what it is, but yeah, that's another frustrating thing. I'm still finding, unfortunately, that my bladder, I'm still having some bladder retention. Every time I go to the loo, I have to sit there and it's not coming, which is a pain. But generally things, you know, from yesterday are still kind of on an upward trajectory. I'm making this video up, standing up, but we've still got, you know, a long way to go, and I am so thankful that that was just one of a 5-day course. Now this will be my second treatment, but we're gonna have to have a break over the weekend because the day case ward is closed. Now, when this treatment was arranged, I was told by the ward that they would prefer to have me next week, Monday to Friday, so that I would do a whole week consecutively, which is better for the steroids. But I was just so bad that I just kind of really appealed my case and said that is not possible. The progression is too bad. I cannot wait another 4 days. And that was the right decision. So I said to them, we will have to break over the weekend, and I'll probably go back to taking some oral steroids, maybe the 20 milligrams, just to try and keep me more stable over those 2 days. But we will let you know how things go today. Bye for now. So I am just back from the hospital after my second dose of steroids. It went really well, but I took a couple of pictures as I show you, but I couldn't do a video because actually the day case ward had a few people in it, some MS patients, a Crohn's patient, and someone else kind of getting treatment. So, it's been a good kind of second dose. Always leaves my head a bit, well, my head's always fuzzy, but leaves my head a bit more fuzzy. And but the good news is I managed to sit up in the car on the way there and the way back today, even though that's still hard and it still flares my back and my head, and I can feel very travel sick. I've always been one to feel travel sick, but since being ill, it comes on very much more acute. But the other good news is that this morning my bladder is working properly again. I'm just kind of going straight away to the toilet rather than this sitting there for ages trying and to make it happen. So that's really good. There's still, because you have to lie in an awkward position with your arm out for the steroids, that kind of kind of gets my neck in a funny position, and I get a lot of pain in my neck anyway, which is probably related to both the arachnoiditis and the CSF leak. And my back, because I'm standing here now and I've been in the car, is hurting, but that's quite normal. Obviously it's a bit more than normal, but I'm feeling less kind of issues in my legs, less pins and needles, you know, like it's there, but it's less. And I'm about to kind of go for a walk because I need to move my body. But even the desire to be able to go for a walk on my own and the energy and my legs working is really good news. So I will keep you up to date on what is happening. So just out on a walk, and glad to say my legs are working a lot better. I still feel that kind of restriction in my back like I had before, but it's not so bad, and walking helps it. You feel like you're doing something to help it, which is really important. My head is fuzzy, my neck hurts, but that's quite normal. It's worse than normal. It's definitely worse than normal, and I'm not going to be able to walk as far, but I'm walking on my own. I am stable, and that's good news. So it's about half an hour after I've been for a walk, and it was really nice to get out for a walk. I probably managed about 1 kilometre. I was out just over 20 minutes. And it felt good to get out. It was painful on my back. It was hard on my head. And as I was saying, my neck hurt. And, you know, the pain did get worse and my legs were getting weaker and tighter towards the end, but that's to be expected. I'm still recovering, and I've just only had the 2 doses of steroids. I can still feel that pulling. It's that typical arachnoiditis tugging, adhesive arachnoiditis kind of tugging in the my lower lumbar, upper sacral, and it's like lots of pins and a little bit of that kind of stabbing, but nothing like as bad as it was. But I knew that it was time to lie down and rest my back and my head. But as you can see, hopefully things are doing well. We're continuing on that upward trajectory, and that's encouraging. We'll see how things go over the weekend now, but I will hopefully take some oral steroids, like with the steroid taper, over the weekend, just to try and sustain the recovery, and we will see how things go.